Start our next category. Our first presenter, Emily.
Everyone. Hi, everyone. My name is Emily Fry, and I am currently a public health major. I'm in my senior year, so graduation is very soon. And I am in the intern program at the Sonoran Center. So for my project that I was working on, I was able to participate in planning an interprofessional exercise in disabilities. And I worked closely with the Sonoran Center, Dr. Tamison Basford, and with the Center for Transformative Interprofessional Healthcare. Basically, what the IPE is it was an event that brought together community members with lived experiences and students who are across multiple disciplines, such as pre-med, PT, other things like that. So the event took place on Zoom. Prior to the event, the students were given pre-readings that were about disability, competent, and patient-centered care. The self-advocates were trained as co-educators, which sharing their lived experiences. During the event itself, during the event itself, virtual interprofessional event, the audience was shown case videos from a woman named Vicky who had lived experience, and they were able to see exactly how her care was handled in these videos. Then they were broken out into breakout rooms, which assessed the care values, and the community members with the lived experiences could collaborate with the students to kind of discuss what the best approach for care would be for Vicky. They focused on collaboration, advocacy, improving patient-centered care outcomes, and multiple other things. We had 13 new community members participating in the event, and over 450 students participated in total. Each event had around 25 to 27 community members participating. Overall, I think the community members valued being heard and included as co-educators. The students were able to gain a deeper understanding of advocacy and active listening and healthcare barriers for people with disabilities, because I think that is something that kind of goes beyond the textbook. And I know in a lot of medical schools and things like that, they don't really always touch on it in a way where it's more personal, and somebody who actually has experienced it can educate the student or the person who is going to be in that healthcare role so that they could do better at their career in the future. The training strengthened empathy, communication, and patient-centered care skills, which is something that was so great. And I think the students were very thankful that they were able to gain those skills from the event. There was potential to reduce the disparities, build trust, and improve overall health outcomes, which was awesome. But overall, I think this event was a great experience for both the people in the community and the students. I think each side learned a lot about how to address disability in healthcare and treat it in a way that is not so that everybody can feel included and feel like they are being cared for well. If you have any contact or any questions about this, you can contact me. My email is right up there. And you could also reach out to the Sonoran Center if you have any questions, because I know they put this event on every year and it's awesome. So thank you so much.
We have our next fun-sized group. Okay. There's three more because you need a phone.
All right. Hello, everyone. I am Alyssa Bernicus, and I am in the Speech, Language, and Hearing Sciences major. I am a junior, and I am a part of the Advocates.
I am Raina Chappelle. I am here at the University of Arizona. I am a pre-med major and I'm a first year. And I'm here with the Advocates as well.
Hi, I'm Ellie Donaldson. I'm in my sophomore year, studying speech, language, and hearing sciences. I'm also minoring in psychology, and I'm here with Advocates.
Hi, my name is Metzley. I am a junior in the Speech, Language, and Hearing Sciences program, and I'm also part of the Advocates.
Hi, I'm Addison. I'm a sophomore and I'm majoring in speech, language, and hearing sciences and Mandarin Chinese. This is my first year with the Advocates program.
Hi, my name is Guadalupe. I'm a speech, language, and hearing science senior. I'm here with the Advocates as well.
Hi, my name is Veronica Bracco. I'm a speech, hearing, and language sciences and psychology major. This is my first year with the Advocates.
Hi, I'm Annika. I'm a second year and I'm also a speech, language, and hearing science major with a minor in psych, and this is my first year in the ADCATS program.
All right. So, hello. As you can tell, all of us are Advocates, and we are part of a program that trains with the Sonoran Center to learn how we can support youth with disabilities who are entering the workforce. Part of this is the belief that everybody can and has the right to work. We advocate for our workers that they can have an environment where they can advocate for themselves. Part of this is we want them to be included, respected, and recognized in their places of work, as well as trusted and challenged with responsibility. This semester, our goal was to learn how we can create inclusive workspaces through the use of visual aids. We did this by job shadowing multiple sites throughout Tucson and observing, gaining experience, and asking questions of our job coaches. From there, we analyzed the factors that improve success as well as the current limitations of visual aids.
We completed job shadowing at local sites such as the Riito Center, Desert Industries, Ace Hardware, among others. Through our site visits, we learned about supporting youth to succeed in the workplace. We also learned that visual aids are a valuable tool to help youth learn real job skills such as punctuality, following procedures, work safety, and maintaining quality. We also learned how to best create and implement these aids in order to help our students reach their own work goals.
Going back to the visual aids, if you all have seen a Lego set manual, you will notice three different things. One, it uses muted colors. Two, it uses little to no words. And three, it uses very simple images or pictures. So as we went into our job shadowing, we wanted to look at the visual aids that were present and make sure that they follow a similar guideline.
So in the workplace, visual aids can make a huge difference. They help with organization, understanding employer expectations, and encourage individuals to complete tasks eventually independently. Over time, as they gain experience and confidence, students may rely less on the visual aids. And even though they are independent, they can still act as a backup system and reduce stress for everybody involved. Improve accuracy and support success and bring experience to future careers.
So here's what we learned from our job shadowing experiences and what makes a good visual aid. So effective visual aids will prioritize clarity, meaning the information is easy to read and understand from a glance. They should be clear and concise, avoiding unnecessary details or visual clutter. And a good visual aid also improves cognitive accessibility, meaning the information is easier to process for individuals with a wide range of cognitive abilities. Overall, these features should help ensure that visual aids are inclusive and effective in the workplace.
Following with the improvements, we found a different ways in which visual aids could be better and more effective in the workplace. So first would be having clear and easy to read font. So it's important for people to understand what they're doing and the information that they're going. And also having visuals such as pictures or icons can be very helpful too by reducing the amount of text required. Having uncluttered formats and material, it's better for them, so it's not too overwhelming. Also, having familiar images is also a key important factor, so students can recognize tasks and work more independently. And last but not least would be having more structure, organization, and adding color contrasts. So it's easier for them to navigate the information. Even though there are small changes, they can contribute a lot with working with you in the workplace.
Visual aids are important because they improve real-world outcomes by making the information easier to understand. Visual clarity reduces errors and speeds up the learning process. When people understand exactly what is expected of them and are shown first visually how to do it, they are more likely to succeed. The visual aids help lower cognitive load and increase accessibility. By separating information into visual parts and removing the unnecessary clutter, we prevent mental fatigue. This ensures that people who may struggle with long text or multi-stepped instructions may still navigate their tasks with independence.
And continuing off of what Veronica said, promoting independence and inclusivity creates environments that support all individuals and empowers others to participate confidently. Inclusivity allows everyone to contribute their unique perspectives and strengths. By fostering independence, we're not only helping individuals succeed, we're strengthening our communities and workplaces as a whole. When people are supported and included, they can engage more effectively, collaborate more meaningfully, and reach their full potential. Thank you so much for listening to our Advocates presentation. We invite you to come join us at our poster after if you have any questions. Thank you.
This one.
Hello, everyone. You're welcome to my project. My name is Mohamed Nabo. I'm an MPH candidate in the College of Public Health. I'm also an intern with the Sonoran Center for Excellence in Disabilities. So for my MPH applied practice experience, I'm working on a trauma-informed care curriculum for disability-focused healthcare training. So for healthcare, when you come to like seeking healthcare, it can be a traumatic or like a challenging and stressful experience for all of us. When you have to go see the doctor, like you're just thinking about it the whole day. So you can imagine someone who has like disabilities and is probably depending on someone else. It comes with an even much more like higher level of stress. And it comes with like it comes with the event where they can even get re-traumatized. So due to this, we are trying to like develop a curriculum that can help with the training of healthcare professionals, which would include students and then like healthcare professionals, just so that they can like think around this when they are like delivering the healthcare to patients who have like any form of trauma. Yes, so to do this, we started with doing a literature review, and then we looked at what has been done so far, and then we identified some gaps in this. And then we also did a survey, and in this survey, we surveyed 59 participants, and we tried to identify if they've ever experienced any like trauma while trying to seek healthcare, and also like what areas of interest they might want us to look at, and whether they are interested in participating in our trauma-informed care curriculum. And then from this survey, we identified that up to, we identified that up to 75.4% of like participants have had some trauma experience while trying to seek healthcare. And majority of them, that's up to like 80.3% have expressed interest that they would be ready to participate in a curriculum for the training of healthcare professionals and students with regards to trauma-informed care. So we also did a semi-structured interview, and then through this interview, we're able to get people who have had these experiences share their experiences with us, and then we're incorporating this into our curriculum. Yeah. So in all of this, all these have like come together to result in the development of an online curriculum, which we are still like working on and incorporating all the feedback we've received from like partners we are working with at the Sonoran Center. And then this, we are hoping to disseminate statewide through training, available training opportunities. And one of the available training opportunities we are looking at is the American University Centers for Disabilities trainings. They already have some existing trainings, and then we are hoping that we can like incorporate this into those existing trainings. And also the IP, that's the interprofessional experience on disabilities here at the U of A. We're also looking at incorporating this into that. And also we are also like looking at other programs in the U of A that we can like incorporate this into eventually. Yes, so ultimately we are hoping that when like anyone at all goes to see a physician or whichever healthcare provider it is, they aren't really stressed about it. And then all their like concerns are addressed, and then they feel like the communication is great, and then they don't get re-traumatized again. So this work is also being funded by the Arizona Developmental Planning Council. And then I also appreciate all the support my mentors like Dr. Duncan, Dr. Thomas, JC, Selena have all provided in making this work to this far. Thank you so much. If you have any questions, you can reach me out on my email here.
While we switch, fun fact, Mohammed's poster won first place at the Public Health Poster Forum.